Good evening, everybody, and welcome to our Wednesday evening webinar. We have a special webinar this evening discussing the very important topic of compassion and well-being in the new normal, something that we all need to make sure that we're mindful of the wider community amongst our own personal concerns. So this evening we have a very special guest with us, Sri Dr Jemilah Mahmood. Many of you know her. She is the Prime Minister's Special Advisor on Public Health and also the Under Secretary General for Partnerships at the International Federation of Red Cross and Red Crescent Societies. Before joining the IFRC, Dr. Jemilah was the Chief of the World Humanitarian Summit Secretariat at the United Nations in New York and was previously the Chief of the Humanitarian Response Branch at UNFPA. In 1999, she founded Mercy Malaysia, a medical and humanitarian emergency response charity. And a Santa Girls School alumna, she graduated in 1986 as a Doctor of Medicine from the National University of Malaysia and went on to earn her Masters in Obstetrics, Pathology and Gynecology in 1992, and she became a member of the Royal College of Obstetricians and Gynecologists in the UK. She's received numerous accolades and awards in recognition of her outstanding humanitarian work, including in 2019 being the first Malaysian to win the ASEAN Prize, as well as the first East Asian Women's Peace Prize and the ESA Award for Service to Humanity. She holds a very dear place in the Davidson household in our hearts as she safely delivered all of my 3 children. And we were just discussing earlier, we in fact named our youngest child Asha after her dear husband, Dr. Asha. So I am utterly delighted to welcome Dr. Jemilah to our webinar. Let me just briefly introduce your host for this evening. Melissa Kong works for Teach for Malaysia. She's a fellow of their 2014 cohort and taught English at a Felder Kampung school in rural Negeri Sembilan. Interestingly, at the time when Melissa was with Teach Malaysia as a teacher, Dr. Jemilah was the chairperson of Teach for Malaysia. She graduated with a Master's in Chemistry from St Hilda's College, Oxford, and works and sits on an exco of the Oxford and Cambridge Society Malaysia, and she does a lot of work on our outreach projects. Our other host this evening is Faisal Arif. He's the CEO of Border Pass, an award-winning startup that gets visitors through the Malaysian airport immigration in seconds. He studied law at Peterhouse College, Cambridge, and at Columbia University, where he was a Fulbright scholar. He's the secretary of the Oxford and Cambridge Society Malaysia, and he knows Dr. Jemilah very well. I hear that she even wrote him in for a humanitarian stint in Afghanistan, and he went back a second time as well. So welcome, Dr. Jemilah, Faisal, and Melissa.
Thanks, Emma.
Thank you, Emma. It's wonderful to be here.
So, Dr. Jim, thanks for coming on to our show. It's always a treat to see you. I'll start off with this. Dr. Jim, the Ministry of Health has done this extraordinary job containing COVID-19, something that has been acknowledged internationally. And the question may be on everyone's minds is right now, where is Malaysia in terms of lifting restrictions? On the one hand, there's this concern worldwide that it's being lifted prematurely. But on the other hand, there's also this very real economic cost to maintaining them. I know it's unfortunately not an exact science, but what sort of indicators do we look at in terms of balancing lives and livelihoods, and what can Malaysia expect in the next few months?
Sure. Well, thank you very much again. A real pleasure to be here and, being hosted by 3 friends. It's really wonderful. On the management of the COVID response, yes, I think that the Ministry of Health, and not just beyond the Ministry of Health, it's also the people of Malaysia have done really well. Pandemic management is not only a health perspective, it requires really community engagement and people to play a role, because you can have the best hospitals, but if people don't want to practice good hygiene and social distancing, you can't beat the virus. So really thanks to the Malaysian public as well. moving forward, I think that even before the lifting of the MCO, there was a lot of dialogue, and I happened to sit on the Economic Action Council as well. So, we had this real balancing act to see, what do we do in terms of ensuring that our economy doesn't just collapse with COVID. But at the same time, lives are the most important thing. So the health perspectives take, priority. So in doing so, what we relied on was facts and evidence. And I think as much as you say it's sometimes a little bit of a guessing game, actually there is a little bit of science to it as well. The World Health Organization has come up with 6 criteria where countries can look at lifting the restrictions, and they're quite specific criteria. For example, looking at the numbers of cases, mortality, and I know that Malaysians are quite fixated. When I walk around with DG Hisham, I tell him he's like a rock star because I have to stop every few minutes. Everyone wants to take a selfie with him, right? But the reality is he's been giving the confidence to the public, sharing the numbers. But beyond the numbers is also mortality rates and recovery rates. And Malaysia has extremely good recovery rates. Our recovery rates are high 80s, and our mortality rate, even though mortality is very sad at the moment, it's only about, and it has been consistently about 1.4%. So that's a decent mortality rate. So when you take all these things into consideration, plus the availability of testing, tracing, and then looking at border control. And this is where when the immigration sort of clamped down, the government did an extraordinary thing of actually putting Malaysians coming back into hotels, and covering the costs for that, so that we are sure they are isolated and contained. Then the fourth thing is also looking at community engagement. That's a very, very important component of pandemic management. When you want to lift, is the public actually aware and able to practice social distancing and so forth. And the last but not least, I think one very important thing that we have to think is about how do you protect the vulnerable, and this is about older populations particularly. Now, in Malaysia, a lot of the elderly populations actually live at home, majority with families. So I think that if you get the message to community that protect your elderly, make sure that you don't expose them, then that's good. So what's happened is that with the lifting, of course, there was a lot of furor and people were saying, oh, it's too early and all that. But what we said is, let's do that, and then if there is a spike, we can easily contain it. And one of the reasons why we put the criteria is not to end coronavirus or the viral spread, because that's not going to end until you have a vaccine. So it will take some time. But it's about protecting your health system so that it doesn't collapse. And our health systems are very, very good. They're functioning very, very well, among the best in the world. Our occupation rate right now in the hospital is very, very low. We have only 600 patients, or I think it's about 600 patients in the wards, which is very, very low, right? So I think all that is the balancing act, and then slowly easing the restrictions. Now, I must say this, because even when we lifted the restrictions, Malaysians are generally afraid, right? So they hardly want to go out as well. So on their own, this is why I think that the public needs to be congratulated for the management of pandemic. They themselves have restricted themselves from going out fully and participating in activities and so forth. So I think now our tone is to encourage people to start going out, to support retailers, and so on and so forth.
Thanks for that, Dr. Jim. Maybe I'll put it this way. Early on, there was this view that the coronavirus acts as this great equalizer, in the sense that it doesn't care whether you're rich or you're poor, whether you're white, black, Asian. It doesn't discriminate. But the mood, as time went on, we started to realize that although we're in the same storm, we might not be in the same boat.
Absolutely.
The rich can afford to work remotely, for example, while the poor are packed into small living spaces. And we've read in the news, some of them have to break the law to survive, cutting hair, stealing food, etc. And on the other hand, there are people like Dominic Cummings in the UK, where they can break the law with impunity. So that there's this element of double standards and elitism, when we look at it, in terms of realities, is the ability to socially distance and comply a privilege or is it a right in that sense?
I think it's both, right? I think it's a right to socially distance. But, how do you tell 20 people living in one apartment to keep your social distance? So we have to be cognizant of the fact that, as you rightly put, that we are all not in the same boat. But there are measures that you can take. Social distance is one. But I think that, wearing a mask that can be made quite simply with an old t-shirt or something, and ensuring that you have soap and water to wash your hands regularly and really avoiding contact is going to be the very important factor as well. And I think this is the very reason why, a lot of people were taken to isolation centers and, put in different centers so that if they had a risk of carrying the virus, they would be isolated from others in a decent space. Sadly, here in Malaysia, the impact is actually uneven, as you rightly put. The ones who are poor and the ones who are less privileged, the ones who don't have access to these webinars, who have no internet access, they are often left out of the picture. And this is where I think the one critical factor is actually communication. And I think that, where this is where maybe we could have done more, but at least we did quite enough to use, conventional media as well, TV, radio, paper, newspapers, of course, social media and all that, to reach every layer of society so that they understand what the risks are, what should they be doing. We are better off than a lot of people. I was just thinking to myself, I worked in Africa for a while, and we're telling people to wash your hands with soap and water, and they don't even have soap, let alone water. So it is an unfair world, right? So, but how do we then ensure that, to the best of our ability, we protect our citizens?
I think Melissa has some questions as well.
Yeah. Thanks, Faisal. Yeah, thanks for sharing that, Dr. Jemilah. I was just thinking about how, like, in the recent calls that we've been in, where we've heard from colleagues from India, where it's just where you can't even wash your hands because the water is also not clear, and how that, and reflecting on how fortunate we are to be in Malaysia. Earlier, you spoke just now about how important community engagement also has been in terms of how comprehensive Malaysia's response has been to COVID-19. But earlier at the start of MCO, I think that from my vantage point, there was, like, I think, quite a lot of miscommunication between different NGOs and with the government, especially with regards to providing aid to marginalized communities, and even now also, like you said, like, I think access is a problem and communication is definitely, like, one way around it, because with the schools that we work with, students are not necessarily aware of, like, what aid is available to them in order for them to be able to access learning or to access food and other kinds of support. From your vantage point, like, what are examples you've seen of how we can effectively bridge this gap in a more collective way?
Okay. That's a really important question, Melissa. One of the problems with any emergency, let alone pandemic, in other emergencies, if it's an earthquake or flood, you can still go and see people. But with a pandemic, even the ones who want to help have a difficulty in actually assessing the people who need that assistance, right? And I think here is where, one of the major problems I think Malaysia and other countries face as well is how do you get a good coordination mechanism? How do you ensure the information flows really well? I came back towards the end of March, and, I saw this, very clearly was a gap, right? And you hear a lot of, noise in Twitter Jaya, I say, there's a lot of, everybody saying this and that, and this is not done, and this is not done. And I sit, as someone from civil society, my heart is still pumping civil society blood, right? And in the government mechanism, listening to then the government's perspective and seeing the data that, a lot of these things that were mentioned, actually they were reached as well, but maybe in not the volume or the quantity. So it was a really very interesting thing. And I actually went to the Prime Minister and I said, what we need is really to establish a coordination hub. that private sector, government, and civil society can come together and to make a clear and transparent process where everybody knows what everybody else is doing, so that no one can allege this person is not doing this and a lot of things. And unfortunately, we are in a very, very unique political situation now, right? Because there's a lot of noise. And he agreed, and I'm very, very happy to share with you that we established something together with a couple of very important stakeholders, Malaysian Red Crescent Society, Yayasan Hasanah, and as well as Yayasan Petronas, and a lot of NGOs, Mercy Malaysia, MRA, a whole lot of NGOs who are really doing extremely good work, not just in terms of health delivery, but also food, livelihood development in the longer term. We want to look at where does education fit in, and we've called this the Malaysian COVID Action Hub, and the acronym is MATCH. But what's more important now is that we've had fantastic support from BCG, Boston Consulting Group, and they have built for us a purpose-built web platform where you can actually input a lot of data so that we can then see very clearly who's being served, who's not being served, and therefore who's well placed to deliver the assistance. Now, this is important because it's not only for civil society, it's also for government to see where the aid is not going, and the private sector who want to donate to be able to know where to put their resources. So we're very excited about this. Shireen, who Faisal knows, who used to be really one of my closest colleagues as the Chief Operating Officer of Mercy Malaysia and later CEO of Talent Corp, and now she has her own outfit. She's now the coordinator for this, and we're going to formally launch it very soon. But we have already collected something like 45,000 data points across 4,000 projects. So this is really exciting because it is an independent outfit. It has private sector, civil society, and government. And we can then share with each other where the gaps are. And I think, and one arm that we want to develop eventually is the advocacy arm, because I think this is, how do you influence policies in government, but very much based on evidence and data, and not emotive, because I used to be NGO myself, right? We are always passionate and we get so upset when things don't go our way. But really trying to drive a culture within the civil society, with government, with private sector, that is very much based on evidence. Cool. So watch this space. It's going to be launched soon.
Yeah, I'm looking forward to it.
Look forward to it.
Yeah, I think the data-driven aspect makes me very excited.
Yeah, me too.
a good an essential foundation for everything. My next question for you is with regards to the welfare of frontliners, including hospital cleaners. So there was recent news around UEM Magenta denying PPE to some of their unionized hospital cleaners, and 5 of whom were recently arrested for it in early June. So wanted to get some of your thoughts.
Sure. And if you follow me on Twitter, you would have seen that I was very upset about it because I think that, everyone, employers need to protect their staff, right? And this is a basic human right. You want people to work in an environment that is high risk. You have to make sure that you protect your staff first. And I'm very, very happy that their charges were dropped and they were released. So I think this is the crux of the matter. Who is a frontliner, right? I mean, we look at the hospital, the nurses, the doctors, essential frontliners, but there are many other frontliners that are putting themselves at risk as well. The cleaners, the police who are there to ensure that, there's peace and order and control. There's so many, the immigration officers and all that. I think that every one of them, anyone in a people facing a role, right, that is really having to deal with lots of people and places where there's potential of the virus needs to be protected. I think what needs to happen now is that there is we don't have we have an act called Act 342. This is the act that is governing the management of the pandemic and where the decision making, the DG has a lot of a big role in this, where you can actually then this is how the fines come in and the arrests and all that, right? So I think that we need to, even after this, I think we need to take a lot of lessons from COVID and refine our pandemic act. I think we need to have a proper pandemic act that's more refined, that looks at, all the different elements of protection. I think that the act is very much again around, if you do this, this is the action, rather than actually there's a right to protect certain people. So I think that's where I think we can refine some of the laws that we have.
Dr. Jemilah, you mentioned this thing about protecting workers. Right? In your view, will COVID-19 force employers to improve living standards and the welfare of foreign workers, or will it simply reduce our reliance on foreign workers going forwards, given that the borders are all shut now? And there's also this broader question of whether non-Malaysians are part of the kita jaga kita equation.
I think Dr. Jemilah accidentally hung up on us. I can't see her right now.
Oh.
You can.
Disappeared for a while. Yeah, can you repeat?
Yes.
Hi. Glad to see you back.
I was like, where did everybody go? Yeah, okay.
Yeah, the question was on sort of COVID-19, its impact on foreign workers. Will it improve living standards and welfare, or the welfare of foreign workers going forwards, or are we just going to reduce our reliance on foreign workers going forwards? And I think there's this broader question: are non-Malaysians part of the kita jaga kita equation?
Yeah. Well, first of all, when I came home, I realized that there was a law. I think it is 466 that was established and tabled and also approved in. Now everybody's gone.
Still here.
Okay. In July last year, and it has now been implemented from June, but enforced in August. That is looking at welfare of foreign workers, because this is very important. Because you saw that in many countries around the world, Singapore ourselves, when we started testing the foreign workers, this is where we get the spikes in numbers, right? But you can't blame them, because some of them live in conditions that are really do not allow social distancing or have enough even sanitation facilities and all that. So I'm very happy that the law has now been implemented, and that by August, if they're giving the employers 3 months to fix their accommodation and so forth. I think you need to give them a bit of time, but from August onwards, if they don't meet the requirements, then they can be penalized. I think that we are touching on a very sensitive subject here, right, about foreign workers and so forth. People like us who have worked in very terrible situations, who have been living abroad, who understand the importance of rights and social justice, feel very strongly about this. Unfortunately, there's also a lot of Malaysians who don't share our same value systems, and you would have seen it in quite toxic narrative that's actually going around. Whether it's around foreign workers, especially when the numbers rise, and they say throw them away, get them out of our country, and all that. Rather than embracing the fact that they are part of our communities, right? And similarly with the refugee communities, a lot of fear, and I think rightfully so with the refugee, because as we close our borders and if more and more people arrive, then becomes a real challenge for Malaysia. So this is a very sensitive, tricky situation. Personally, I'm very affected by it. I even made a trip to the detention centers to look at the situation, and I must say that I saw some pretty good things that were happening in the detention centers. That there was a medical care there for them. The place was very clean when I went anyway, and I didn't go like a VIP trip, right? And I had my medical friends with me, and I said, "Is this how it's normally, the situation, or did they just clean up for me?" And they said, "No, it's actually like this, right? Because you never know." But the fact is that we one of the things we need to do much more is a lot more communication with the public on the value of migrants, the economic value even of refugees, right, who come to our country. But more than anything, have we not learned that a tiny, tiny virus of about 25 nanometers can actually stop everything, right? If you don't have health security, you don't have any security. You don't have economic security, you don't have social security, nothing. And if anything, I would hope that people become more compassionate and really realize that it can hit anyone, and nobody actually wants to have that virus. But if you're in a situation imposed it because not of your own doing, because you're cramped, because you can't afford it, how do you expect to run away from it, right? So I think this is I hope this is where I think civil society needs to play a very important role, communicating with people. And for me, communicating with leaders, who I meet on a daily basis, talking about, situations of, where there's positivity, right, in engaging with refugees and migrants. I mean, I always tell the story of Italy that had a terrible experience with COVID. But as a result of which, the government actually then legalized all foreign workers and migrants. And same thing with Portugal. I think that, that was a result of them realizing that they were all in this together, and that these people had contributed not just to the economy, but also in a way to the response of the country in terms of COVID. So I think we didn't give a chance to our refugees and migrants to participate in our programs as well. But I think how do we now tackle this very, very toxic narrative that is going on? I don't have an answer. I'm still trying to figure it out.
We all are, I think.
Yeah. Dr. Jemilah, there's a question from one of the viewers online. From JLo from Unseen Charity and Mohiba Food Bank. They're part of the frontliners, and they're trying to provide more than 10,000. They're trying to provide a lot of free lunch and essential meals. They've been doing that since the start of MCO to today. They've been feeling a lot of uncertainty with regards to navigating the government law around it. They've applied for permission to distribute essential foods, but they haven't heard back.
Okay. Wait, I'm going to try and close this chat because I was reading it. Okay. First of all, I don't know the details of this charity and who they wrote to, and which area they're trying to serve. So I will say that I don't know the details. What I do know is this, right? Now that it's a bit more open and movement is more or less unrestricted, I want to know why is it that they're having problems. That's now question number one. Who are these groups that they're delivering to? Is it high risk groups or groups that don't have access? That's one. The second thing is, I really firmly believe that we need to move away from hot meals and boxes of goods to cash. I think that I worked for many, many years abroad, as you know, and the last 4 years I've been working in the Federation. I'm no longer there, Emma, by the way. I left when I came home, but we ran in 2019 a 1 billion Swiss franc operation globally on cash. Why do you choose cash, and why is it that the global aspiration in the humanitarian sector is that at least 30% of your programming needs to be cash? Because cash is about dignity, right? Cash is about giving people choice. It's not about giving a box with your label on it, right? It's about giving people a choice to choose what they want, And at the end of it as well, in this time now, is also to stimulate local economy. I think this is very, very important to remember. I want to tell you some stories about my experience with cash, right? I'll give you two stories. One is a woman in Zimbabwe that we followed, and we gave her a cash voucher and followed her to a store. And we were all sort of taking side bets to say, what will she pick first, right? And we thought, oh, maybe she'll pick flour, maybe she'll pick some coffee or sugar or whatever. She picked a bar of soap and a bottle of head lice shampoo. And this was my boss, right? Asking her, so why did you pick up soap and head lice shampoo when you actually need food? And she said, I have some food, which is okay, but I need to wash my children and myself, because if we smell, then we can't be, mingling with our community. And number two, my children have head lice, and if I don't clean them out of the head lice, then they can't play with other children and they feel terrible about it. So this is about dignity, right? And this is so important. The second, which is a really cute story, was after the cyclone in Bahamas, a hurricane in Bahamas, and a woman received her cash voucher, and she decided that she would go out shopping. And what did she buy first was a pair of earrings for her daughter. And she said, it's Christmas and I need to give my daughter something that she can be happy about. So what I'm saying here is that we don't know what are the elements of dignity that people hold so dear to themselves, right? For the woman in Zimbabwe, it was about, again, her children and herself feeling clean and, having her own dignity. And for the other mother, it was about, making her child happy. That was more important to her than anything else. So when you start only giving food packages and so on, yes, it's very important. But in a time now where market is open, we must transition to cash. I think this is, I would love to see organizations like Mercy Malaysia and all that really committing to 30% of their programming being cash, especially when it's no longer the emergency phase we're in recovery phase now.
Thanks for sharing, Dr. Jemilah. Yeah, I think what you raised around like the importance of dignity and just empowering people with choice is like,
yeah,
it goes a much longer way than just like giving them a meal. Yeah. The next question that we have is around whether you feel that Malaysians are more generous with our time and money and other resources towards those that are less fortunate than ourselves. I think especially given your extensive track record with the field.
Yeah. When I will tell you that my experience with volunteering and charity and humanitarian did not start at Mercy Malaysia. It started when I was at home as a child, right, being educated by my parents. And I always tell people that my first humanitarian mission was May 13, when I had to deliver food to the neighborhood that I was living in. But when I founded Mercy Malaysia, it was at a time where there was very few humanitarian organizations, right? And I remember saying, and Faisal might remember this, is that, Mercy Malaysia was built for Malaysians to show Malaysians that development is beyond tall, high-rise buildings. It's about people. It's about your ability to see beyond yourself, your values, your compassion, and how the world is so interconnected at a global level. And my dream was that this was a seed I would plant that a lot of people would benefit from, but more importantly, will catalyze a change in Malaysia. Now, I then left in 2009, right? I come home now in 2020. And it's a very different Malaysia. There's so many civil society organizations. People are all self-organizing. And another thing I would say is that, formalized organizations will probably see themselves declining. Certainly in the West it has. Malaysia will take a long time to catch up. But people are now, more keen to help each other out. And we've seen this, right? I've been following social media. I saw Faisal, write sewing PPEs. I didn't know he could sew. So I saw Harith Iskandar delivering boxes of food, Project Hope and all that. I saw, people just coming together to do good. And you don't have to have a formal structured organization to be able to do that. And I think that part of our success story that must be written is about the people of Malaysia who have come together to assist those who they need to help. Now, at a very, at my level even, right? I mean, the fact that we were sending food to each other using Grab food, right? I mean, Grab delivery. I cooked something nice and I wanted to share it with somebody I hadn't seen for a long time, so I called Grab delivery and they delivered. Why? Because we just wanted people to have a sense of that I'm thinking about you, that we're all in this together. So I think that it's really important to really stress that. And I hope we come out of COVID-19 feeling that we are connected much more to people. At least a lot of people have seen the suffering, particularly in very marginalized communities and poor communities in the urban settings. And I will stress urban settings because there's more challenges in urban settings than I think rural settings. But having said that, my mother-in-law lives in a village in Pahang, and she's 80 years old, right? And she has a WhatsApp group that is about who's cooking what today and who's sharing, and all this kind of stuff. So it's really nice to see.
Cool. Thank you for sharing, Dr. Jemilah.
Yeah.
I think you shared. We spoke a little bit about like the different issues that have surfaced because of MCO, and one thing that I've also seen surfacing more lately is an increase in domestic violence since the start of MCO. What are your thoughts around what the role that we can play in addressing that?
Can you repeat the question?
It's with regards to the increase in cases of domestic violence since the start of MCO.
Oh.
Yeah.
Okay. Yeah. I think that, when I sit in the coordination meetings on a daily basis, what happened is that we get data from the police, right, about cases of domestic violence. What's happening, what we're seeing is that on the police side, we're seeing not a high increase. But part of the problem is that if you're a woman or man and you are subject to domestic violence in an MCO period, there's no way you're going to make a report. Or how do you make a report? So this is where I think, there's been very good suggestions from civil society, from Sisters in Islam and all that, we have to have some signs, right? That if somebody delivers food or your neighbor sees you, that it's a warning that you're being, you have been abused. Now, this issue of domestic violence in crisis is not new. It happens in every form of crisis because, there's additional stress, there's mental health pressures and so forth. I think that, I think what we need is, again, I'm going to stress a pandemic is very different from any other crisis because in other crises, you can go to one place to another. I think what we need is to step up our thinking and policies as well around domestic violence, but also looking at how do we, what kind of innovative warning signals or that we can actually alert someone of violence happening. The second thing is we need to deal with the mental health pressures, right? I think that for the longest time, mental health has been stigmatized, right? If you say that you have a mental health issue or something, people will say, you go to Tanjung Rambutan. The way, the posture around mental health is very negative. Whereas you and I know, and I'm sure all of us have experienced it, there are times when we feel really down, right? Or, and we need really professional, somebody to talk to and all that, right? Some of us are lucky we have that, some don't. So I think that happens in a lockdown situation. You really have this, you're stuck in the same place with the same people day in, day out. And I think that, how we need to also look at mental health as a social issue now that has to be destigmatized. We have to talk about it in schools. We have to talk about it in the workplace. There has to be, thank God for befrienders, but also just there should be many more, places where people can have an outlet to get help. So that's the underlying issue.
Do you want to share maybe a little bit more? Because my next question for you was
Yeah.
also around
Mental
maintaining
health.
well-being, especially around
Yeah.
mental health. Yeah.
Yeah. Again, you know, everyone has different coping mechanisms, okay? And it also depends the situation you're in. As I mentioned before, if you live in one of the, you know, low-cost flats for the B40, and you're stuck in a small flat with poor ventilation, you know, any normal person will also be stressed. So, you know, we have to find some of our own protective mechanisms. Now, one of the things I've been talking about to a couple of people is how do you make psychological first aid a must know by everybody, right? So maybe through, you know, Malaysian Crescent, Malaysia and others, how do we have, you know, we are doing so many webinars and all sorts of things now. How do we have much more of this, you know, to teach the everyday person what is psychological first aid, which means that how do you identify if somebody is under stress and so forth, and where do you get help? This again, you know, it's easy to talk about it, but it's not so easy to implement, right? But we have to start somewhere. I think that, you know, this is something I've been discussing as well with a couple of the ministries in our government to say, where does this sit? Actually, it's a cross-cutting issue. It is from education to, you know, women's ministry to health ministry to human resource ministry. It's cross-cutting. Actually, well-being and mental welfare is cross-cutting. Now, I want to tell you something that I experienced today. I didn't realize it, but at 11 o'clock every day in the Ministry of Health, no matter where your office is, you get this blaring live broadcast of get up, move around, here's some exercises we do, you know, every day, you know, so much so that a lot of the staff told me that they memorize all the movements already. But I think, you know, exercise is very important, you know, moving around, getting some fresh air and all that. So it's so how do you build in some of these protective routines in the workplace, in the school environment, you know, at home, that you create some routines that will actually help you, you know, sort of focus and center yourself.
Dr. Jim, we've got another question from our audience by
Yeah.
Mark Disney.
Yeah.
He's asking, why are most of the progressive or liberal NGOs and civil society movements in Malaysia established and run by women? Mercy, Bersih, SIS, Tenaga Nita, etc. And his question is, what's wrong with our men?
And he's asking the question. He should be telling us what's wrong with the men. How do I know what's wrong with the men? So I think that you know, actually that's a very interesting observation, right? But I'm sure there are lots of I mean, MRA is very male. Imaret is very male dominated as well. Yeah, Teach for Malaysia are two men, you know. So I think it's not maybe that's an observation. Probably good to do a bit of research on this. Why men? But I think generally, right, women are good organizers, right? Women are, you know, we are used to multitasking. I mean, Faisal, you know me very well. You know what mad life I lead and how I can do like 10 things and juggle 6 balls at one time, right? Because I have
Men
to.
can't do that.
Yeah. So I think it's an interesting observation, but I'm not sure it's entirely true. I think there are a lot of very good male-run, male set-up organizations as well. I think SOS, yeah, there are lots.
When I first joined Mercy in 2001, there was a very acute shortage of men. I remember that. It's very much
Yes.
a women-driven organization.
I know. When I ran the World Humanitarian Summit in the UN, men were only like 3 out of 35. So, you know, so I'm sorry. Or rather, I'm not sorry. Yeah.
Melissa, you got another one?
Yeah, there's a question from Emma.
Yeah.
She asked whether this crisis has made us a lot more mindful of mental well-being and whether it has helped to remove some of the stigma around discussing mental health.
Yeah, I think this is what I was saying earlier, right? At least now you're seeing a lot more, you know, people talking about mental health issues. I think, you know, organizations like, you know, Mercy Malaysia, like, you know, what do you call this? This very interesting organization run by Raj.
Souls 24/7.
Yes, and then there's of course Malaysian Red Crescent. There's also Dr. Amir, Siddiqui. He's like the front man, right, for mental health in Malaysia. Very vocal on social media, on television, and all that. So it's good. It's good things. But the important thing is, how do you create that shift to destigmatize mental health? I think this is going to be critical. And you must remember this: the ones who are talking about mental health are probably the ones who are more urban, are more educated, are more exposed. I doubt that many people, again from experience, right, from Aceh tsunami and all that, the people in the villages didn't want to talk about it until until I think it was Irish Red Cross, established a radio station and all that. And then even men came to talk and voice their own pressures, right, after the trauma of the tsunami. So I think it's real. It does exist in all layers of society, but I don't think that the ones who are more more distant from the mainstream dialogue are receiving the attention. So I thought, how do we tackle that? I think, as I mentioned earlier, it has to be a cross-cutting issue across different disciplines. But I also think that faith-based leaders need to be able to talk about it much more, and not just say, you have to be more patient, your faith must be stronger and all that. That's I was going to use a very rude word, but that's not entirely true, because mental health issues are real health issues, and they should not be seen as a weakness on the part of any person who has symptoms or whatever.
Cool. Thanks for sharing. This is the last question I have for you.
Yep.
That's that I've prepared. As you've shared previously, our healthcare system has had a world-class response to the pandemic. What can we do to support our frontliners who have been working non-stop?
I think everyone has. I mean, the frontliners are probably the most loved group of people in Malaysia right now. I tell DG, like, he's most loved human being, then your frontliners are most loved group of people, right? But I think they know, they're very aware of that. What I'm trying to do in my role as advisor is actually to look at the health reform agenda. And I think that if we really care about our frontliners and our Ministry of Health, it does need a lot of more forward thinking around how we manage the human resource. How do we, people don't want to be rewarded sporadically. I think what we need is a bit of a systems approach to how we take care of our frontliners, but also looking at all the different things that we can do to strengthen our already very good health ministry. I think many people don't realize this, that we underestimate how well we've done. If I give you some data, people always talk about New Zealand, right? And how wonderful Jacinta Ardern is, which I completely agree. But you must remember, New Zealand has a population which is tiny. It's an island state. Nobody's going to come and cross their borders. So they have 1,500 cases or something for a population that is a fraction of what Malaysia's population is. And we have 32 million people and 8,000 plus cases and only 121 deaths, right? On the other hand, if you look at the UK, and since you're all Oxbridges, UK has doubled our population and already, I think, 300,000 cases and a lot of mortality. So I think, again, it's also an island nation, not to worry about who's going to cross their borders and so forth. So if you don't realize how remarkable the country has dealt with COVID-19, I think we're just being biased. The fact is that Malaysia has done really, really well. I think that, as I said, we should learn from this. The pandemic is not going to be a one-off. Unfortunately, this is not a black swan event. We saw it coming. It was a matter of when and not if. And when will the next pandemic happen? And don't forget that, while the pandemic is going on, there's also other impacts of climate change and the climate crisis, that is not going to pause while this is going on, right? So how do we now, as we bounce back, look into a much more holistic approach to health? I'm a big fan of planetary health. If you want, you can follow my webinar on Monday with WHO. But it's about looking at the whole systems approach, that health is now an intersection, intersects with climate, intersects with economy, intersects with environment, intersects with all sorts of things, right? And how do we look at it that, if you have a sick planet, you will have bad health, right? And the reason why we have a pandemic and the same reason why we have a climate emergency is the very same reason. Massive industrialization, environmental degradation, close contact of humans and animals because they've been displaced from their normal habitats. 3 out of 4 cases of health crisis will be zoonotic or animal vector, sort of animal vector diseases. So I think a lot of us have to rethink now. And I think for Malaysia, my advice would be, as we recover and as we look at the economic development, rather economic recovery, we have to look at it through a green lens, right? There has to look into a new deal for economy. And this COVID has provided us a tremendous opportunity to, as you say, press the reset button and try to get ourselves aligned to a healthier climate, healthier environment, healthier people, healthier economy.
Dr. Jim, you mentioned borders and also the economy as well. Travel, tourism, 15% of our GDP, a pretty big chunk, and is completely paralyzed right now all around the world. There have also been some newspaper articles on the diplomatic attempts to build up green lanes between two countries, 3 countries, etc. Where is Malaysia, going on that? Are we sort of saying that no, we're going to keep our borders shut, or have we been in negotiations with other countries for, let's say, mutual recognition of each other's COVID-19 testing, and try to reduce that 14-day quarantine period through establishing standards and PCR tests and things like that to enable the industry to start up again? Has that been part of the discourse?
Yeah. In fact, we've moved quite a lot already, right? There's no more quarantine hotels and stuff. It's now home quarantine. There will be a major announcement soon. I cannot disclose what are the details of the major announcement, but we have been in discussion since yesterday, and tomorrow morning will be another round, and then hopefully there'll be an announcement soon. But as for tourism, every country is affected, right? I think that one of the things I was saying, to some people I met, that during even the COVID, the MCO and the CMCO, I think our tourism industry has to rethink their model as well, right? For example, I'll just give you an example. Our hotels and our petrol stations could have been easily turned into logistic depots, because that was a time when people were using a lot of delivery for assistance and for all our online shopping and whatever. But how I think our hotels and our petrol stations didn't think about that, and didn't think that here's a business opportunity actually for us to in the interim do a couple of things. Because I saw in Norway, for example, they don't really have post offices, right? Not many. But if you go to a supermarket, that's where your packages are dropped. So as you do your food shopping, you pick up your online orders and stuff, which I thought was really impressive. So I think that moving forward, what COVID has also exposed is that it's not going, that old normal was not really good, right? So we have to we're in a transition phase. I wouldn't even say we're in the new normal. I don't even know what's coming soon, but I think that the new normal will be established soon. But this is not the new normal. This is just transition. And I think that what is also exposed is that the way we do business is going to be different. The way we have we embrace technology. How do you ensure that there's digital penetration, in the most remote areas? So all these things we need to start thinking about and putting in place. How do we have contactless payment from now on, right? I mean, in the past, you have people like my husband who are terrified of anything that's an app, but how now do I convince him that actually you have to learn to use some of these apps to pay, or, contactless cards or whatever. Yeah.
We've got another question from Emma. How do we encourage and educate young people to develop more empathy and compassion? I mean, I couple that as well with, we've got rather high unemployment historically now. Whether, encouraging young people to volunteer, for example, the way the US did during their Great Depression,
Yeah.
might be one of the ways to do that.
I think, to encourage compassion, it has to be organic, right? I mean, it has to develop organic. Is that the right word? Anyway, it has to start from it being part of your habits. I shared my own experience of my parents being very generous and very, inculcated into us values that you have to be compassionate, you have to help other people. So, it has to begin with us as individuals, as parents, to create the environment for children to feel that, it is part and parcel of my life to think about somebody else. I give you very simple things that, I can say what I've done is from a very young age, expose my children to charity and all that, but also saying to them every time you get money, whether it's Hari Raya or Chinese New Year or whatever, X% must go to a charity. So it's up to you where you want to put your charity. But how do you build that, that habit in young people that is not just about material gains, it's actually about thinking of other people. And that, I must say that I was embarrassed and also proud of my son when he was very young, that we were in Sabah and, he saw there was a poor man, with a begging bowl. And, and Adam said, "Mommy, the man's really poor." And I said, "Okay." So I took out maybe $2 or something and I gave him 2 ringgit. He looked at me, he said, "But you can afford more than that." So he taught me a lesson that, I told him he has to give a certain percentage of his whatever he has to charity, and he thought what I was giving was not what I should have given. I should have given much more. So you have to build that kind of habits in young people. Now on unemployment, Faisal, you're right, volunteering is good, but volunteering doesn't pay enough, right? So how do we make sure that I'm very much in favor of the fact that we got to maybe go less urban. There's a lot of good land in Malaysia that can be developed, and how do we encourage young people that actually farming is the new hip thing, right? I have my own little urban farm at home. I have ducks. I have all sorts of things, and because I want to live sustainably. So how do we now encourage young people that maybe you don't need to live in Kuala Lumpur. Maybe you need to live a little bit outside. And I've been very impressed. I'm following somebody on Instagram, Noraisha or something, who has a master's degree, but she's living really off the land. And I'm so impressed. And if we have a food security issue, right? Malaysia has a very high importation rate of food. Why aren't we turning to farming as an industry? And then there's other things as well, as I mentioned about the digital age, there's so many things you can do. And how do we then now upskill or reskill our human capital? And the government has actually allocated quite a lot of funding into reskilling talent, so that they can then compete in a very new market.
I think in the one of the budgets for Penjana, I think farming
Yes.
very much on
Yes.
the agenda. Even the previous package, I think they set aside about 1 billion ringgit for farming, and
Yeah.
I don't think it's been touched just yet. But
Yeah.
maybe they'll
I
change
want
in the future.
Yeah. Faisal, there's a question why you got the cool blurred background. I asked you the same question as well, because he's using this fancy camera, which we
I
don't have.
am.
Yeah, but there's one very good question, and Dr. J. Low has been asking a lot of questions on the chat, because I'm also monitoring the chat. And Dr. Low, I was also once like you. I started Mercy Malaysia with zero humanitarian knowledge. Okay, what I learned was through books, through web. That time we don't have the internet that's so fast and all that, right? It's really by observation, and mentorship and partnership is is key. And I'm very happy to see Dr. JLo has partnered with Mercy Malaysia and others. So through this platform called Match, one element of that platform is capacity development. It's about ensuring that other civil society organizations can get the tools, can learn, and maybe even be matched with other larger organizations so that they can grow their organizations, right? And to be accountable. I will share with you my own personal experience, setting up Mercy Malaysia. It was really, learning from experience, partnering with others, not being afraid to ask, not being afraid to say you don't know, and being, and the most important thing is putting in systems that hold you accountable. And because of that, we had public trust. What is it that civil society sell? They don't sell commodities, they sell trust. That's your only commodity, because if people trust you, then they will support you, and how do they trust you? They trust you because you are accountable, not just to your donors, but also to the people you serve. You listen, you engage with them. They're not people sitting there waiting for you to give them handouts, right? It's about engaging with them and what is important for them. How do they participate, and how do they lead in humanitarian operations? Not you leading all the time. How do you change that narrative that is not, and balance the power, right, between you and the person that you're trying to help? And it requires us to really understand the nuances of humanitarian response, and also be more humble, and perhaps, always trying to work ourselves out of a job, right? So that the less people we need to serve, the better off we are as a nation, as a community. And I think that, organizations like Mercy Malaysia, Malaysia Red Crescent, and all the other organizations that are part of, Match now, one element of that will be capacity development. How do we make sure that everyone has an opportunity to learn? So please watch out for Match. Match will be really about some of the larger organizations building a satellite of smaller organizations around them, and then, building those capacity. I think we've learned now through webinars and all that. There's a lot that we can learn from each other, that we don't need to spend money, organizing big fancy meetings and providing food and all that.
Okay, on that note, we've just hit the 1 hour mark. Emma, are you still there?
Yes, I'm here. That was amazing. Thank you. I knew I would be, because I've always felt incredibly uplifted every time I listen to you, or any interviews that you do, or when you talk to you face to face. And yeah, I mean, you've left us all very hopeful for Malaysia and our future, but also mindful of the role that we all should be playing, and how we should be able to come out of this terrible epidemic that's happened, this pandemic that's happened, and how we can all come out of this as individuals and as communities and as society, as better people. And I think you've sort of mapped out a very clear, honest, genuine roadmap for how we should be doing that. So immensely grateful for your insights and your anecdotes and your stories, and your honesty. And it's wonderful. It's really wonderful to see you again. So thank you so much. That was lovely and great. And thank you to Faisal and Melissa as well.
Yeah. Faisal's going to come and see me soon.
I would love to, yes.
Yeah. I want to leave you with one thought.